Alright, so the topic I have for my presentation is exercise for those with a lower limb amputation. So getting started, there's two main types of leg amputation. The first is unilateral. So this is where one leg has to be affected, but the other leg is left perfectly intact. So an example would be like if I had my left leg amputated below the knee, but my right leg is perfectly fine. And this is compared to a bilateral amputation, where portions of both legs are removed. Going beyond that, there's also different levels of amputation, and they range all the way from a forefoot amputation, which could be something like removal of your toes or some of your toes, compared to hip disarticulation, which would be the amputation of your entire leg at the hip joint. So on this scale of amputation, they'll have a different effect on how the person lives their everyday life after the operation, what they're capable of doing, and just how independent they are, how long rehab takes, and what exercises and activities they can take part in. Speaking of the operation, there's also different stages of rehab. I won't go that far into it because unless you're working as a therapist or a surgeon, this won't really affect us very much. But basically, there's an acute hospital post-operative stage, and this is the 5 days to 2 weeks after the operation where the patient is closely monitored just to make sure that they're not having an infection and that they're doing well after the operation. Next is immediate post-acute hospital stage, and this is where the patient is first introduced to their temporary prosthetic. It's temporary because as the wound heals, the shape of what's left of their leg is going to change, so you don't want to buy a permanent prosthetic only to have it not fit a couple weeks later. And then the last stage is transition to stable stage. This is 12 months to 18 months after the operation. And this is when the leg becomes fully healed and its shape becomes permanent. In this stage, the patient is focused on becoming self-sufficient and independent. And when you get into stable stage is when they would start going to exercise and getting back to just activities of their daily life. Alright, so getting into the pathophysiology, subjects with an amputation tend to have poorer circulation, and they also tend to have lower metabolism, higher blood pressure, and higher heart rate than they did before the operation, and with this comes a reduced tolerance to high workloads. But with that said, clients with leg amputations aren't as at risk as other populations. For example, someone with diabetes, you have to be careful what their blood glucose is before, during, and after exercise, or they could end up in the hospital. Whereas when you have someone with a leg amputation, the focus is more on balance, pain, flexibility, and kind of just what exercises they believe they're able to do and what exercises they are able to do. So it's just kind of improving what kind of functions they can. Some common issues to work around are the prosthetic that your client has. You want to check this to make sure their joints are at the same level, because if you have like one knee higher than the other, this will lead to muscular imbalances, and that'll lead to discomfort and pain. You also want to check to make sure the prosthetic fits securely and fits correctly. If it's not secure, then they're not going to be stable as they're exercising, and it also won't be comfortable, and no one wants their leg hurting every movement they make as they're working out. There's also physical barriers to work around, which is like how functional a prosthetic is, kind of how much weight it can support, how it's able to move. And then there's also limb pain again, and what equipment you have so that you can adapt to the exercises they need. And then next with that are mental barriers, because a lot of people are going to respond differently. For example, like if you took exercise psych, they talked about how athletes respond to injury, whether it's something to overcome and deal with, or if they just think that it's going to ruin them. Will depict how they go through rehab, they go through their exercises, and how they get back to what they were doing before. Getting into exercise testing, how you test your client will depend heavily on the individual and what they're able to do. Like bike protocols would be okay, as well as walking protocols if they're able to walk well, but that you might want to stay away from because a lot of people, especially when they first start, won't be as efficient when they walk. I also saw a lot of information on using protocols for rowing machines, which was interesting. because you can row with 1 or 2 feet. So if your client wanted to do the protocol using just their good leg, that would be okay. But they could also do the whole test using their good leg and the prosthetic leg. With that said, also, both max and submax tests can be used. We want to keep in mind other conditions they have and what would be appropriate for these other conditions. So don't just go off of this, but look into what other comorbidities the client will have. Getting into exercise programs, it's kind of similar to what the exercise prescription would be for a normal, healthy person. So aerobic training, it's recommended 3 or more days of aerobic training per week. And this could be a total of 150 minutes of moderate exercise at 40 to 60% of their max heart rate, or 75 minutes a week of intense exercise, 60 to 80% of their max heart rate, or any combination in between. This could include biking, rowing, walking if they're really high function, or walking and running if they're really high functioning, different sports or games that people with prosthetics can play, or swimming too is another big one. Just anything that the client is able to do that will get their. Getting into resistance training, it's recommended that they train with weights 2 or more days a week. This intensity can vary as they get further along in their program, but it's recommended that you start with light resistance. Like even 60% of a max at 12 or more reps would be enough to see a huge improvement in their daily life. You should emphasize the hip muscles because amputees, since they have a lack of mobility or lack of even having a knee or an ankle, you have to compensate through the hip. And so strengthening and stabilizing those muscles will help them with the range of motion, and it's also directly related to how well they can walk. Along with that, core muscles are especially important just to keep them stable and balanced, because walking on one good leg is hard to do. Flexibility should be done every day too. Emphasizing stretching the hip muscles is just as important as emphasizing strengthening the hip muscles, as well as if they are amputated below the knee, you want to make sure they have a maximal range of motion within their knee. That way they're able to have the most effective walking and moving pattern possible. So it's recommended you hold stretches for 15 or more seconds, do 3 or more sets per muscle group, and try and keep it to like 8 to 10 stretches per stretching bout. The last part is balance training. This should be done 2 or more days a week, but it can be done every day. It only needs like 10 to 15 minutes per session, but it's important because a big part of training with someone with a prosthetic leg is for them trusting the prosthetic, since you have no proprioception in the leg like you do with a regular leg. So like if I were to step out, I can feel what's beneath my foot and I can trust that my foot is going to land on the ground. But since someone with a prosthetic doesn't have that kind of feeling, they have to just trust that it's going to be there and it's going to be underneath of them when they put it there. So some drills you can do for this, I found what was called braiding. It's kind of like karaoke where the subject will stay like square to one direction, but they'll walk laterally, crossing their feet over each other and just learning to balance as they cross their legs. There's also circling an object, one-legged stands, sitting and standing, and kind of just like any functional movement that they'll do throughout their day is good to practice, just so they get it down and they feel comfortable doing it. The benefits of exercise for someone with a lower limb amputation, the main one is just improved daily function, because having, like I said earlier, increased hip strength and mobility is directly related to being able to walk better, and being able to walk and move better on your own after having leg amputated goes a long way for making you more independent and self-sufficient, which in turn just makes life better, because not having to rely on someone to move or go places is a big deal for someone who had been bedridden or just learning to walk again. It also will improve their heart rate. Like I said before, people with leg amputations have poor circulation, they have a higher heart rate, higher blood pressure, and decreased metabolism. Exercising improves all of these. Because they're more aerobically trained, they'll have lower blood pressure, a lower heart rate. their metabolism will improve, so that'll prevent weight gain, and circulation will be a little better. For my case study, I said my imaginary client was Jerry Smith, who's 35 years old, 5'9", and 168 pounds. I said 18 months ago he had his left leg amputated above the knee, and he's just finished rehab. He has a blood pressure of 142/92, a resting heart rate of 84 beats per minute, and since the operation he's been sedentary. His goals with exercising were to become stronger, more flexible, so he isn't as limited by his prosthetic leg, and as well as to improve his balance so that he can golf again. I said he falls into the moderate risk category because he has 2 cardiovascular risk factors, which is stage 1 hypertension because his blood pressure was above 140/90, and he has a sedentary lifestyle because since the operation over 3 months ago, he hasn't been active. Because he's moderate risk, I would have him perform a graded submax test before we start the program, which I could pick the bike test, the YMCA bike test, or I could look up a rowing test to have him do. It would depend on what he's comfortable doing. With the exercise prescription for Jerry, I said his cardiovascular training, he would take it part in 4 days a week for a total of 30 to 60 minutes per session, and I would try and keep around 40 to 60% of his max heart rate. This could include swimming, cycling, rowing, walking, or any games he likes to play that he's capable of doing now. It would be good to mix it up day to day so he's not doing the same thing day in and day out until the exercise program doesn't become stale. For strength training, I would begin with bodyweight exercises, just kind of like going over and getting comfortable doing movements. So it'd be like maybe wall sits, wall squats. You could do planks. A lot of upper body movements wouldn't be as limited. So like a pull-up you can do push-ups. You could do like skull crushers or just anything where your back's supported, you're not standing, you wouldn't be as limited by. But a lot of like the leg exercises or core stabilizing things would need to practice. Over time, you could add more weight as he's more comfortable with it. So when he becomes comfortable squatting in his leg and his prosthetic leg, you can maybe have him do lightweight goblet squats and just progress this as he becomes better at it. I'd keep it at 8 to 10 exercises per resistance session and go 3 sets, 8 to 12 reps. So like I said, this could be like pull-ups, you could do farmer's carries, just body weight squats, push-ups. Hip bridging was a big one because that's just all hip activation. Sit-ups or straight leg raises could train the amputated leg without loading the prosthetic directly. For flexibility, I'd spend 15 minutes each workout stretching with a focus on hip mobility and full range of motion in Jerry's good knee. You spend 3 sets, 15-second holds per exercise. Like I said earlier, keep it to 8 to 10 stretches per bout. For balance, you want to go 3 days a week at least, 10 to 15 minutes. Practice common and functional movements using one and both legs. Just anything that's challenging so he becomes more comfortable and confident with his movements. So in conclusion, lower limb amputees have a higher heart rate and blood pressure than the general population, but they also are not as at risk with exercise as people with other diagnoses. Aerobic training will improve their heart rate and blood pressure, it'll increase their metabolism, and it'll also improve their circulation. But the biggest thing is it'll increase their independence and self-esteem, which is just going to make their life better. Here's a picture I found when I was looking through ones I thought was pretty interesting. And here are my works cited.